Hey guys, Dr. Shook here. I hope you guys are doing great today. What I want to talk to you guys about is, today is a question that I get asked a lot, and that is, why can't I lose weight? And this is really, guys, there are a lot of mechanisms and things that can cause you to not be able to lose weight. But one of the topics that I wanted to kind of stay with a theme, we've been talking a lot about digestive tract function lately, and I really want to share with you guys this connection between the gut and an inability to lose weight. Okay, so guys, do me a favor. If you guys like this topic, if you like these videos, then please do me a favor. Vote for me by sharing it. If I see that a lot of you guys share this video, then what I'll do is I'll make more videos like this. If I don't see that no one shares it, then what I'm going to do is I'll just stop making videos like this and I'll talk about other topics. But really I'm going to focus on the gut and weight loss. So if you guys like these, please do share it. If not, then I'll talk about another topic. But so what we're going to talk about today is how gut inflammation stops weight loss. Guys, this is really, to me, this is really interesting. And you just learn more and more that everything is connected. So let me show you a few things here. All right, this is our digestive tract, large intestine, small intestine, and it has, these red dots are meant to be inflammation, right? It's not chicken pox. It's inflammation. So this is an inflamed gut, and there are a few different things that we commonly see drive inflammation of the digestive tract. So infections of the gut are very, very common. Bacterial, fungal, and parasitic are very common infections of the GI tract that we see. We find them all the time in people that have no digestive symptoms. That's right, we do a comprehensive stool profile and they come back that they have infections in their gut. And guys, these things they drive inflammation, which we're going to see that inflammation has a very profound impact on your metabolism. The other thing is that we see is that autoimmunity to the digestive tract drives inflammation. So IBD is just an acronym for inflammatory bowel disease. Okay, so inflammatory bowel disease, things like Crohn's disease, colitis, and celiac disease are also things that we see commonly drive gut inflammation. And then food sensitivities are also important, because if you're reacting to the foods that you eat, it drives an inflammatory process. And I'm getting ready to show you guys how the inflammatory process can cause you to shut down your weight loss and actually contribute to weight gain. Okay? So an inflamed gut can contribute to weight gain. So let's talk about how this occurs. So inflammation, inflammation in the gut will create systemic inflammation. So if your bowel's inflamed, that inflammation doesn't stay in your gut. It actually is in the bloodstream and it's in circulation. And what it will do is basically the inflammation, when you're inflamed, you have a higher level of inflammatory chemicals called cytokines. Now, all you need to know is that if you have inflammation, it's going to cause these problems, okay? But I wrote them out here because commonly what we'll see is that there are some of these chemicals, they're made by your immune system, that can create problems for metabolism. In particular, these are called interleukins, interleukin 1, 2, 6, TNF-alpha, NF-kappa B, and C-reactive protein. Okay, just know, and there are others. But just know that these are inflammatory chemicals. When your gut's inflamed, you have these problems, these inflammatory chemicals go up. When they go up, what it does is it decreases a hormone that your body makes called hormone-sensitive lipase. And you see the arrows pointing down because it decreases hormone-sensitive lipase activity. The reason that this is so important, guys, is because what this does is it helps to break down your fat cells so that you can use them for energy. So if you have decreased hormone-sensitive lipase activity, it's not good. It means you're not going to break down fat cells and be able to utilize the triglycerides and glycerol inside your fat cells or your adipose tissue for energy. So this is going to cause you, inflammation will cause decreased hormone-sensitive lipase activity. It's not good if you want to break down fat. Now, the other thing that it does that's negative is that it actually increases fat and sugar release from the liver. So your liver is also, it does a lot of different things, but it also stores fat and sugar, so that if your blood sugar gets low, for example, it will release your stored blood sugar and the stored fat into the bloodstream so that you'll have energy so that your brain can keep running the functions of your body. So this inflammation will decrease your ability to break down fat for energy, increase fat and blood sugar inside the bloodstream. Guess what happens when blood sugar goes up, guys? Your body produces another hormone. When blood sugar goes up, what hormone's produced? Insulin by your pancreas. What is insulin? Insulin is a growth hormone. You want insulin to stay steady and low. And guess how you do that? By keeping blood sugar stable. When blood sugar goes up or down, anytime it comes up, insulin's going to spike up. And anytime insulin's high, it's a growth hormone. It puts you in fat storage mode. Guys, you can't have this happening. Inflammation decreases your ability to break down fat for energy, increases the release of sugar and fat from the liver, resulting in an inability to lose weight. So guys, let me share a story with you. I have seen a lot of people, and in particular, I remember one of my female patients that came into me that exercised all the time. Okay, she exercised. She did cardiovascular training. She did. I don't think it was Pilates, but it was like she was always exercising, 6-7 days a week. Now listen, more exercise is not always better, but in her case, she was exercising a lot. She was not losing any weight. She had muscle tone, but she could not lose body fat. And she was very depressed about her inability to lose weight. She couldn't understand what was going on. She put out all this energy and effort. She was eating a diet that was lower calorie, and she couldn't understand why she wasn't losing weight. Guys, GI tract infections and systemic inflammation were creating this. So here's someone who felt defeated, felt like it was just a problem with them. And guys, you've got to look at this chemistry. You've got to look at what's happening. If you cannot lose weight, you cannot be inflamed. You cannot be inflamed. Everything in the body is connected. So you've got to get this stuff under control. Now, I want to tell you guys something. Inflammation can be produced a lot of other ways than this. It doesn't just have to be the gut that's producing this inflammation. Right? You can have autoimmunity to other tissues. I mean, there are other sources of inflammation than the GI tract, but it just happens to be a very, very common one. And it's one that we want to talk about. We've been talking a lot about the gut the past several days. But I remember I see this all the time. And I just remember this one patient in particular that came in to see me that was having all this difficulty, putting out all this effort, eating a certain way, trying to do all these things, and was so frustrated. And a lot of people, what they do is they think that I see in my world, they come in and they think that it's just them, that they just can't lose weight. And it becomes this thing that psychologically they just believe their body is not meant to burn fat or burn calories for energy, and that they're just going to be that way no matter what they do. And that's just not the reality. That is not. I don't believe that statement to be true. The thing is that you've got to look at the chemistry and you've got to see what's going on. And a lot of people come in and they think, you know what? They think that they need more thyroid hormone, or their thyroid hormone levels aren't high enough. Guys, everything is connected, and if you don't look at inflammatory levels, that's the first thing I look at on labs. I don't even look at the thyroid hormone first. I look at inflammatory levels. Everything is connected, and you've got to take it into consideration rather than just trying to cut your calories. That can have a negative effect. If you cut your calories down just because you think, well, I've got to consume less calories, I know a lot of you guys have heard this. You will actually put your body into a starvation mode, and it will, as a protective mechanism, it will drop your metabolic rate. If you do not consume enough calories, your body will think it's starving, and it will slow the metabolism as a way to try to preserve your health and your life. So guys, look at the whole picture. Okay, look at the whole picture. Now I'm going to tell you, where do you think I'm going to tell you guys to start with this? Where am I going to tell you to start to decrease inflammation, to improve blood sugar, and to improve these hormones? What am I going to tell you to do first? I'm going to tell you to start with your diet, right? You guys know there's a lot of different diets out there that can have a positive impact on this. So you can try like autoimmune paleo diets. You can do that. You guys, the dietary program that we have, the 6-week Hashimoto's transformation program. Guys, that diet is specifically designed to improve your digestive tract function, decrease inflammation, and balance blood sugar. Everything I just told you. Everything that we've done, our dietary program and also the lifestyle and temporary supplementation programs are designed to support just this. We've seen people lose 30 pounds. I had one person that in 6 months lost, actually she did it by about 3 months, lost 60 pounds following our dietary plan. Now she lost a lot of water that she was retaining because there was a lot of inflammation. It improved her hormones. Guys, if you want to lose weight, you can try, like our program has worked tremendously well for a lot of people. Those results aren't typical like 30 or 60 pounds, but you can definitely lose a significant amount of weight, improve your energy function pretty quickly with the Hashimoto's transformation program. And if you're interested in that, guys, we give it away to one person every single month. Just go to thyroidgiveaway.com. That is, you can go to like thyroidgiveaway.com, go to that website, and it's actually, you can just enter to win it free. And it's a great place to start. But guys, this is really important. This is something that you've got to address if you're trying to lose weight. And guys, I hear it a lot, and I understand. You know, with thyroid dysfunction, this is a big problem. But what I find is that most people, it's not that they don't have enough thyroid hormone. It's that there are things like inflammation that are contributing to their inability to lose weight. So you've got to address the root driver of the process. Guys, I hope this has helped you out. Today, I'm not going to be able to do a lot of question and answer at all. I'm probably going to have to go. Actually, it's already 5 o'clock here. But I really appreciate you guys. I appreciate all of you joining and jumping on these live streams and supporting us. You guys might know our website was actually shut down for about 3 days. The office of, it's at drbradshuk.com. We had so much traffic on it that the internet service provider actually shut down the account because it was taking too much of the resources on their server. So we had it moved, and it should be back up, and it should be able to handle all the traffic and people that are going there. But I really hope that this is helping to improve you guys' understanding of your problems, your quality of life, and I hope you're getting some actionable information that can really help you. So if there's anything that we can do for you guys, just reach out to us. We're definitely here for you. I'm going to keep trying to do these live stream videos. I'm shooting for about 1 p.m. or noon Eastern time, but it doesn't always work out that way. So I'm going to do them when I can. I hope this really helps you guys out. And if there's anything we can do for you, just let us know. Thanks. Hey guys, Dr. Shook, thank you for viewing our videos. I hope they help you out. If you want to, just subscribe to our channel somewhere here. You can watch a video that YouTube's actually selected for you, so hopefully it'll help you out. If you need any other information or resources, just look in the description. We've got links to our website, to our 9 lab test guidebook, and everything else that we do. I really appreciate you, and I hope you guys have a great